So this is one of the very important condition in obstetrics, in the delivery specialty, where we are supposed to immediately attend to these patients and try to see that they will be rescued from the very bad stages of this PIH, pregnancy-induced hypertension, that may be pre-eclampsia or eclampsia or HELP syndrome. These are some of the terms we will be using when we are discussing this chapter. Okay, hope you are getting me. So pregnancy-induced hypertension, which is leading to many of these complications, is when the diastolic blood pressure, you know that normal blood pressure, whatever it is 110 by 70, 120 by 80, something like within 130 systolic, and here not more than 84 or 86, something up to maximum up to 90. We put usually those people as normotensive, normal blood pressure. But when the diastolic blood pressure, especially diastolic blood pressure, what does it represent? I think you all know, you have studied already the basic medicine. That will show the proper, the hypertension in the patient when it is more than 110 millimeter of mercury on one occasion, or diastolic blood pressure more than 90 in 3 or 4 times you see, today, tomorrow, or twice a day, whenever it is showing only 90, 92, 94, then also you have to consider it as she is prone for pregnancy-induced hypertension. And we classify it as mild hypertension, moderate, that is 150 by 100, severe 160 by 110. So you're getting me now? Okay. So pregnancy-induced hypertension in pregnancy is categorized as mild, moderate, and severe. So the use of mercury sphygmomanometer is the gold standard, even though we have now electronic sphygmomanometer, but there are sometimes some controversies regarding the blood pressure measurement here. So we usually believe in the good old, even now we all senior doctors, we usually appreciate the sphygmomanometer where the mercury column is seen, what you people have learnt in the ward and all, how the mercury column rises and slowly drops down with the muffling sound. That is the instrument like usually we depend on to record the blood pressure. Measured with women seated, not when she is standing and she should be relaxed. Please see that the woman is seated, at least 5 minutes she will relax. Don't hurry up. If she has walked and come from a big distance, she will be naturally showing little bit of hypertension because the sympathetic system is put to pressure. So once she relaxes for some 5 minutes, you can make her sit down in the seated position. You can really record her blood pressure to see that you will get a proper reading. The appropriate cough or cough sound for measuring the diastolic blood pressure is always used, which is muffling and then disappears, is the one. That's the basic blood pressure measurement you people know. Sometimes a pregnant lady develops hypertension. I said it is a pregnancy-induced hypertension. But some ladies, if it are some woman has conceived by 34, 35, 36, little late in her age group, she has already have a hypertension. She doesn't have anything, but hypertension she is already having. Already she is with some 130 by 90 or 140 by 96 like that. That time also we have to be very careful. She may be pregnancy superimposed with the hypertension superimposed with pregnancy. Hypertension and pregnancy. It may not be PIH, pregnancy induced, but she is already having a hypertension and she is pregnant now. We have to treat her also in the same guidelines, even though there may be some minute differences. Hypertension diagnosed after 20 weeks, not normalizing after 12 weeks of postpartum, is usually a PIH lady, pregnancy-induced hypertension person, normalizes after the delivery, after the 12 weeks of postpartum. But the lady who has developed this PIH continues like that and she keeps her pressures high only, then she becomes a hypertensive. And the same lady, when she conceives the next pregnancy, then it may be she is hypertension who has got superimposed with the pregnancy. This condition usually complicates nearly 3 to 5% of pregnancies, and it is the double the risk of the PIH, we can say. It has got its own risk because already she is hypertensive. So the gestational hypertension, pregnancy-induced hypertension, presenting after 20 weeks without significant proteinuria, resolves within 6 weeks. Usually the simple pregnancy-induced hypertension which usually see in the ward, a mild one, usually settles within the 6 weeks of delivery. And it occurs in usually the incidence is about 6 to 7%, even though it is a very less, we can say it is nearly 10 to 12%, we can say, especially depending on the season. The incidence also varies. 15 to 25% develop pre-eclampsia and tends to recur in subsequent pregnancies sometimes.